Hey guys, it's Dr. Danny Sugai, board certified dermatologist in the Seattle area. I'm a medical, surgical, and cosmetic dermatologist, and I've been spending the last 5 years online trying to debunk skincare myths and just really address misinformation out there. There's too much misinformation, and this is why I created an online course for doctors or any healthcare professional, whether it's a nurse or pharmacist or other healthcare provider out there, to get online and battle this misinformation because there's so much out there. So today we're gonna be reacting to your TikToks out there, and I have some comments, some teaching points, and some videos are actually very dangerous and they need to be taken down, and I really had to make this video to address them because I was on vacation in Japan and some of my colleagues sent me a particular video, which we'll talk about very soon, that really got my blood boiling, and I had to get on and make a TikTok when I saw that while I was in Tokyo. So I'm back home and I want to do a long form video on this, so let's jump into it. All right, first off, I've been seeing this a lot. Throw away those magnifying mirrors. You don't need a magnified mirror because I've been seeing this a lot in clinic. A lot of my patients, especially after age 40, you guys are in the mirror and you're looking at every little imperfection and you're trying to pop, squeeze, get various tools to try and go after these little trapped cysts under the skin called milia, and they're little whiteheads. And yeah, there are some that can be quite large and obvious, and I do have patients come in. They usually do have to pay an out-of-pocket cosmetic fee for these benign cysts to be extracted, and they're quite easy to extract. But you don't want to do that at home, especially if you don't have the correct tools, sterile tools. I do it quite a bit for my patients, but I'm seeing a lot of patients coming in saying that they're not happy with the way they look, and a lot of it's just looking at their face magnified. When we are looking at you, we don't see a lot of these things. Yes, as a dermatologist, when during your skin check, I am getting close to you, and I have to look at all the little pores, any strange bumps that may have appear, whether they're red, brown, or flesh colored. I have to get up close. But when we're talking, you know, at a socially comfortable distance, we're not up in each other's faces and we can't see a lot of these imperfections that people are pointing out. So I just want to say real quick, don't do the magnified mirrors. That's just not real life. And I feel like people are damaging their skin by trying to grab unnecessary physical exfoliating scrubs like St. Ives or other scrubs with harsh beads. And they're also going at their face with various tools or even pore vacuums, pore strips. They can be quite traumatizing to the face, especially charcoal nose strips. I've had a bad experience with Biore sending me some charcoal nose strips, and it literally peeled the epidermis off of my nose, and it was not good. I was really afraid of having either post-inflammatory hyperpigmentation or permanent scarring.
Acne like that? What's the solution? Baking soda and water.
Okay, I've reacted to his videos before, and he's quite popular, but he had said in a previous video to use urine on your face because it has urea, and urea is great for fine lines and wrinkles. That's false. And two, don't be putting urine on your face. Urine is a waste product. It's from all the toxins and waste from our body, and it's being excreted by our kidneys, and we pee it out. And that urine, yes, does have some urea, but it also has a lot of toxins. It can also have bacteria in it. Traditionally, we used to think that urine was sterile. As soon as it came out of the urethra, it's sterile. But we've actually found that there's bacteria, native bacteria, commensal bacteria in our bladder. And so your urine isn't completely sterile. You don't want to be putting a bunch of bacteria on your face either. Go with the synthetic stuff in the lab, your favorite moisturizers for your face to help moisturize your face, and not go for PP, or like we say in Hawaii, shishi. We don't want to have shishi on our face. But anyways, this guy is now saying apply baking soda on your pimples. So from the image, it looks like this patient has really bad jawline hormonal acne, and hormonal acne is a really tough thing to treat. And a lot of times topical medications can't be enough to treat hormonal acne. Putting baking soda on your face, I mean, baking soda is very alkaline. It has a high pH. You know, we want a slightly acidic environment on our skin. We're gonna mess up that whole barrier. We're gonna really disrupt that skin barrier. Our skin barrier is gonna be crying, and when you mess up your skin barrier, you're at risk for more acne. And this is really bad advice. And he said, go ahead and spread it all over your body. If you have body acne, don't do that. We don't want a high pH product sitting on our face. Really bad advice. So don't do baking soda, don't do toothpaste, don't do the apple cider vinegar. I've seen people get chemical burns from apple cider vinegar when they try to douse their face and acne with apple cider vinegar.
If you can't eat your skincare, then you probably shouldn't be putting it on your face. This is beef tallow, and it's the only thing that I put on my face.
So they're saying you shouldn't be putting the products on your face if you can't eat it. I was looking at the page later on, and they talk about toners and different cleansers that they have on their storefront that you can purchase and they earn commissions. I don't think they're ingesting their cleansers and toners that they're promoting, right? They have a lot of K-beauty products too. So the messaging is off. You should be using beef tallow, which they're selling certain beef tallow products to get commission if you buy the beef tallow products. But I bought some pure beef tallow. This is for cooking purposes, of course, but just smelling it, it smells like a brisket. We had a barbecue this past weekend. I can't imagine putting this on my face. This is just animal fat just rendered down. Yes, it looks like it could be very moisturizing and occlusive, but this is known to be very comedogenic. So if you have acne prone skin, I would be very careful with this. Most of the creators who talk about beef tallow online, the messaging is the same. It's don't get the whipped beef tallow because it's full of air and you're wasting your money. Get grass-fed beef tallow. I mean, these are probably the people who talk about cruelty-free skincare being the way to go and having clean skincare, and probably the ones who say put shishi on your face to work on fine lines and wrinkles. No, use a regular moisturizer, guys. You don't need to get beef tallow on your face and you're gonna smell like a brisket. You're gonna clog up your pores. People demonize preservatives, but we need preservatives in skincare to prevent microbes from making it rancid. Like this does not have any of the preservatives. This will go bad. Beef tallow belongs in your cast iron skillet and not on your face. So that's all I have to say. If it works for you, go right ahead, but be very careful with the what can come of it. I see other products with essential oils or beeswax in it, and both can cause an allergic contact dermatitis very commonly, especially on the face. So be very careful. Go with gentle skincare instead. CeraVe, Cetaphi, Avene, Neutrogena, all the tried and true. I'm gonna stick with that.
There has not been a single study to date that shows that if you diligently put on sunscreen every day, it decreases your chances of dying from skin cancer. Number two, the most common form of skin cancer, which is basal cell carcinoma, almost 1 in 3 Americans, fair-skinned individuals, will develop it. In every single study we've looked at diligent sunscreen use versus no or minimal sunscreen use, there has not been a change in the incidence of basal cell carcinomas developing on sun-exposed skin.
Wow.
When I looked him up, he looks like a very reputable dermatologist and Mohs surgeon. It seems like he's been trained really well, but I feel like the editing is a very persuasive editing format here. The strategy here is to try to have us turned off by sunscreen and having him, it appears that he would say that sunscreen is not helpful for preventing skin cancers and preventing skin cancer related deaths. He had quoted certain things that are true, but let's break it down and what's available in the data and how we can change the messaging, because this messaging right now does seem pretty misleading, I'll have to say. Let's fact check that first claim. There has not been a single study to date that shows that if you diligently put on sunscreen every day, it decreases your chances of dying from skin cancer. Now, if you fact check that, it is true. There's no randomized trial that has been shown that sunscreen lowers mortality, but there was a trial, the NAMBOR trial, and others that show that sunscreen reduces the incidence of melanoma and squamous cell carcinoma. So not specifically basal cell carcinoma, which happens usually from sun exposure we get early on in life, childhood, and it could be from intermittent sun exposure or sunburns even. And it takes many years or decades to actually develop. So to make a study like this, to design a study that will follow patients from very early on, have used sunscreen, to later on looking at basal cell carcinoma developing and also causing mortality is pretty hard. It's gonna be a very difficult study to do, especially if you're collecting tens of thousands of subjects. So what we do know though, using sunscreen will reduce the incidence of melanoma and squamous cell carcinoma. And then by preventing melanoma, we can say that it is reducing melanoma related deaths. Now looking at his second claim, in every single study we've looked at, diligent sunscreen use versus no or minimal sunscreen use has not changed the incidence of basal cell carcinomas on sun-exposed skin. Fact check, partly correct, yes. We have randomized control trials, like the NAMBOR trial, like we said, showed sunscreen reduce SCC or squamous cell carcinoma, but not basal cell carcinoma. Like we said, basal cell carcinoma risk is tied to those early life sunburns, intermittent UV exposure, and decades of DNA damage, repetitive DNA damage. It would be hard to prove that sunscreen is going to change the incidence of basal cell carcinoma because it takes many years for it to develop. But let's look at what we have so far with the studies. What we have shown is that randomized controlled trials have shown that sunscreen significantly lowers sunburn incidence. And what we know is sunburns lead to skin cancer, including basal cell carcinoma, especially if it's done in childhood. But there was another study that was recently published showing that sunburns, even in adulthood, will add to your risk of getting basal cell carcinoma. So by saying sunscreen does lower the incidence of sunburns, that's a big plus. And we also have tons of research saying that sunburns can increase your risk of skin cancer, including basal cell carcinoma. And we have to say, although it'd be hard to make a study, a large randomized controlled trial to follow basal cell carcinoma, from what I have, I can say that sunscreen likely lowers your lifetime basal cell carcinoma risk. There's a lot of anti-sunscreen videos out there. Ooh, that's way too much retinol. Or tretinoin. Ooh, that's gonna really wreck your skin barrier. So I've talked about this a few times recently on my videos. Just really, guys, a pea-sized amount is all you need. Using too much retinol or tretinoin like this is gonna wreck your skin barrier. You're gonna wake up with a red, swollen face. I see this all the time in clinic. This is probably the most common retinoid mistake, is using too much tretinoin or retinoid on your face. Using more does not make it work faster, does not make it work harder, be more effective against hyperpigmentation, your acne, or your fine lines and wrinkles. It's just gonna set you back and cause dryness and turn you off. And you wanna be turned on to this because you're gonna use it consistently every other night to nightly to work on acne. If you wanna work on hyperpigmentation, it can take 4 to 6 months. If you wanna work on fine lines and wrinkles, you gotta be on tretinoin or some kind of retinoid for at least 6 months. Just a pea-sized amount. I'm gonna show you real quick what a pea-sized amount is. Right there. That's all you need. Break it up into 2 dots on the face. I like to start at the forehead and have the most there, and then connect the dots. Keep it outside of the orbital bone. Don't put it on your eyelid skin unless you're using a retinol eye cream or a retinaldehyde eye cream like Avene's. But the most popular retinol eye cream is RoC's that my patients like to use and I like to use as well. And then go ahead and apply your favorite moisturizer over this, whether it's CeraVe's PM or their oil control gel cream. You want something with peptides, you can go with Neutrogena's Collagen Bank, and then you can also apply your beef tallow. I'm just kidding. Don't apply this over your retinoid. That's gonna go for my steak later.
I don't recommend biopsies in most cases. And your body is so much smarter than you think or give it credit for. If it detects abnormal or toxic cells, it will form an encapsulation around it, doing its job to keep the threat and danger contained.
Yeah. It's definitely an opinion, and it's an unpopular opinion. She knows it. I looked her up. She says she's a holistic naturopathic doctor. I see no record of her actually having an ND degree, and if she's only just done a weekend course or an online course, or she's had formal training. But this is very dangerous information. She needs to take this post down. This is really, really bad information to tell the public that she doesn't believe in biopsies. When I was a medical student, we learned that pathologists were the doctors of the doctors. They would look at the actual tissue and tell us what's going on and give us their recommendations. And they said, if you have no tissue, there's no issue. You need that biopsy to cinch the diagnosis, and even we need to subtype things. So in dermatology, we need to know the depth of the melanoma. How early is the skin cancer? Did we find it early enough? Is it a melanoma in situ or stage 0? Or has it gone deeper into the skin and we have to actually look at lymph nodes and do scans? If you can catch a melanoma at stage 0, the prognosis is excellent. Versus if you have it go down just the thickness of a piece of paper, it could actually be a different story if it's gone down to the second layer of skin called the dermis, where all the blood vessels and lymphatics are. That's a huge difference, and that's why we need biopsies. Whether it's in dermatology or cervical pap smears, where we have to look and see if there's any precancerous lesions, precancerous polyps. That's really important. You know, when you get your endoscopy, colonoscopies, doing biopsies is so important. So for her to have any recommendations to tell the public to delay the diagnosis, do laboratory tests. There's no laboratory test to tell you if you have melanoma or not. She's being like getting a bunch of blood work, you know. That's just bad information there. So Guys, don't delay diagnoses. I'm seeing this a lot in clinic. People are trying to put ivermectin cream on their skin cancer or take some kind of horse dewormer that they got at the feed store because they saw it online to treat their melanoma. These patients are passing away because of this bad information. So thank you guys for watching. Always here to debunk myths and to address misinformation. Please hit the like button. Please subscribe to the channel. And I'll see you guys for new videos every Saturday. All right, take care and peace.